I just would like to take a minute as we close out this year to kind of think about where we've been over the last 7.5+ months since Dr. Slaoui and I were notified and presented at the Rose Garden in May. So what have we done? We've developed 2 safe and effective vaccines now for use, authorized for use to the American people. We've scaled up manufacturing capacity, in some cases building new brick and mortar from the ground up. We've issued 18 Defense Production Act ratings, which allows us to prioritize materials, supplies, and equipment essential to the U.S. government contracts. It puts them at the front of the line. Hired and trained new staff and embedded logisticians and supply chain experts in all the manufacturing facilities as we move forward. We developed and launched a new data system that connects hundreds of existing systems at the state and local level to allow us to have visibility so that we can see ourselves across the entire United States. We've executed extensive planning, starting with the CDC putting out their playbook in September, and then extensive coordinations with the state health officials every day, every week, and every month since. And it continues as we go forward. We dedicated regional planning teams that are constantly available 24 hours a day, 7 days a week at the CDC in support of the state and local governments. We provided IT specialists to help all the jurisdictions to see themselves so that they understand exactly where everything is at a single point of time. They can plan and direct accordingly. We developed a program, the CDC really developed a magnificent program to, in collaboration with CVS and Walgreens, to go to all of our long-term health care facilities and administer a vaccine to really one of the 2 top priorities, the elderly living in these homes. Over 906 clinics conducted to date as we ramp up to 4,000 a week. So really remarkable tasks. We've inked a partnership with 19 pharmacy chains to ensure as we go from stage 1A to 1B that we can expand the capacity of distribution throughout the country, which gives everybody greater access to the vaccine in each state as directed by the governors and the state health officials. We funded distribution for vaccines alongside of ancillary kits to ensure that those things were there when they were needed. And we did this early on so that we had the right distribution mechanisms and the right ancillary kits to be distributed with the vaccine. And we provided dry ice to everybody that wants it on the first replenishment for all Pfizer vaccines. We cut through the red tape, right, to ensure all the vaccines provided to Americans will be free of charge. And finally, as I started out with, we've allocated and will be available for final ordering 20 million doses by this Thursday, distributed more than 14 million doses of vaccine to over 10,800 locations. And we have administered over 2 million doses in the last 2 weeks. Really a remarkable feat. And everybody collectively should be very proud, right? The federal government, industry, academia, state and local governments. It has been a whole of America approach.